Aortic aneurysm, we sometimes call it silent threat or deadly weapon or ticking time bomb. Albert Einstein had a aortic aneurysm. You open up the abdomen and sometimes some surprise will come up.
Should I blame my ancestors or should I put my cheeseburger down?
When it is going to rupture, we don't know.
What is that one thing which affects our pipes very badly?
Nowadays, treatment has become much better, less lengthy hospital stay and faster recovery.
Today, we are talking about something big, literally, that is aortic aneurysm, the human ticking time bomb. So welcome to the program, Dr. Bhavin. It's always good to have you.
No, it's my pleasure, Dr. Lakshmi. Thank you.
So before we dive into the serious stuff, so what exactly made you choose this vascular surgeon? I mean, is it the love for the complicated pumping job or the cool tools?
So, frankly speaking, it was kind of accidental choice. Vascular surgery was, you can say, down the line in my choice. But accidentally, I became a vascular surgeon and now you can say I'm loving it. Why? Main thing is, if you see, in a surgery, anytime if any damage to the blood vessel or basically in our general surgery also we were taught that you should be staying away from the blood vessel. If you injure them, it will be difficult to manage. And now, as a vascular surgeon, we search for blood vessel, we go for that and we repair it. So you can say, yes, really adventurous job we are doing.
That's wow, wonderful. So we're here today to talk about a deadly topic, if I can say so, that is aortic aneurysm. So how would you like to explain this terminology to someone who's very new and doesn't understand at all?
To explain that, I should explain about aorta. Aorta is the largest blood vessel in our body. It connects heart and it takes blood from heart to all other organ, right, through the different branches. Now, occasionally or rarely it happens that this blood vessel become dilated, more than 1.5 or 2 times a normal diameter. And once the diameter increases, there are chances of rupture. Now you can imagine that main blood vessel which carries the blood with this much pressure, if it ruptures, definitely it can be a deadly. And that's why aortic aneurysm, we sometimes call it silent threat or deadly weapon or ticking time bomb, which can blast anytime and it can be lethal, it can kill a person.
So is it like you're blowing too much of air into the balloon and it blasts, something like that?
So you have taken excellent analogy. You can say that yes, it is like a balloon. If you inflate more, if you put more air into that, it will rupture. Here, different thing is, we are not putting air or anything, but in this pipeline, already pressurized blood is running.
So if the aorta is the road, okay, so how would you like to see the aneurysm like? I mean, is it like a pothole like a situation or is it like a bridge collapsing onto the road?
So, simple thing, it is like if there is a small hole in a dam, it's like that situation. It's not like simple. If dam is overflown or if it is broken, what will happen? It will lose hell to the below thing or any villages coming in the way.
So what's the role of genetics into somebody developing aortic aneurysm? I mean, should I blame my ancestors or should I put my cheeseburger down?
Yes, surely genetic or family history plays a major part in this. If my father or my grandparents had aneurysm, there is a high chance it may come to me. But it is not the only thing. Other than that, yes, it is more common in men. So yeah, you should be less worried. I can be more worried. Why? Because it is almost 4 times common in male population. Age is another factor that we commonly see. After 55 years of age, it can be quite common. Other than that, other comorbidities like hypertension and hypercholesterolemia, or you can say more lipid, can affect. Other than that, one modifiable factor is smoking or tobacco used in any form. Some people say, I don't smoke, but I'm chewing the tobacco. They are at an equal risk of this.
And also, aortic aneurysm is a less heard terminology, but I'm sure many celebrities have been detected or diagnosed with this. So what is your take on this?
Yes, particularly I have chosen this aneurysm topic also is because of that only. There is not enough awareness in our society about aneurysm. People don't know what is aneurysm. Now, if you talk about aneurysm, Albert Einstein had a aortic aneurysm. Other than that, George II, King of England, was having this aneurysm. So yes, it is not that much common, but it is not that much rare also, and we should give enough importance in identifying this. Why? Because if I say aneurysm doesn't come to you like that, okay, I'm having this thing and this is a symptom of aneurysm. No, they are more silent, incidental findings. You have gone for the abdominal pain checkup and then you see that there is an aneurysm. And that's why it becomes important to know about this disease.
And also, it's a bomb ticking inside you and it's ready to explode anytime.
When it is going to rupture, we don't know. But as size increases, risk increases much more. So yes, ticking time bomb is the right terminology we are using here.
So, Dr. Bhavin, when you diagnose someone with this condition, I mean, is it like you just push them to the OR and get the treatment done? Or do you take time to explain what it is? How is the situation like?
So no. Here, we generally divide this into two types of aneurysm. One is ruptured aneurysm, where it is an emergency situation. It's already leaking somewhere. Then definitely you have to send them to emergency room, or you can say directly to the theater, operation theater, or nowadays cath lab. But otherwise, asymptomatic aneurysms, they are electively treated.
So, what is the latest treatment which is available to treat these conditions today? I mean, are there any cool instruments or tools that you use in the OR?
Because of newer advancements, what we do is many of the patients who are suitable for this kind of treatment, we do not do the open surgery. We treat them with endovascular treatment. We call it EVAR. EVAR means endovascular aortic aneurysm repair. And next day, you can discharge the patient without any cut or any other problems. So yes, nowadays treatment has become much better, less lengthy hospital stay and faster recovery.
So, talking about surgeries, Dr. Bhavin, which one do you prefer, the open heart surgery or the minimally invasive surgeries? I mean, which one gives you the real kick? You can be honest with me.
So no, as a vascular surgeon, if you would have asked me this question 10 years prior, I would have definitely told you that yes, I want to do the open surgery. But now, if you say because of the advancement and other treatment modalities are available, I prefer endovascular treatment right now. If a patient is having suitable anatomy and other things, then right now I'll go for the endovascular treatment where we put a aortic stent graft in the aorta.
So, aortic aneurysm being a very serious, deadly condition. So, before performing the surgery, do you get nervous or anything? How do you prepare for the surgery? Or is it just like any other surgery?
Here, in aortic aneurysm repair, whether it is open surgery or endovascular, lots of planning is involved. Because one step goes on the other side or not according to our plan, there is somebody's life at stake. So definitely, we always feel that kind of a pressure. But what happens over the time, you get adjusted to that part. But still, if you ask me, every time before aneurysm or any other major surgery, we always update our knowledge. We read also about anatomy and other things, and we prepare ourselves. Second thing, as a surgeon, what we have learned basically that every time you go inside a operation theater or a cath lab for any procedure, you should be having plan A, plan B and plan C ready. Why? Because everything not be what you have thought in your mind. You open up the abdomen and sometimes some surprise will come up. So that's why planning is the most important part in all these things.
So, looking at the circulatory system of the human anatomy so closely, what is that one thing which affects our pipes very badly?
Quit smoking. We have seen the very much bad effect of smoking. Whether you talk about aortic aneurysm or peripheral vascular disease or any other things, it can destroy your life like anything. So definitely would like to pinpoint to one thing, then it is smoking. We should not do smoking.
And personally, Dr. Bhavin, you being a surgeon, I'm sure you'd be having long hours standing in the OR and having a very hectic schedule. So how do you balance your life, or what's your health mantra?
So no, if I talk about that, Dr. Lakshmi, our body is very much flexible. How you tune it, it will go accordingly. Now, if I'll think about this, that for some open aortic surgery, I have to stand for 12 hours, I'll be tired. No. Once you are into operation theater and you have started doing the surgery, you forget other things. What you said, tiredness goes away. Nothing works like charm of a surgery. But coming back to this thing, after those 12 hours, definitely you feel so much tired. You want to go directly to the bed. Yes, but work-life balance helps us a lot.
So, doctor, with you working for so many hours in the day, having a very hectic schedule, I'm sure. So, how does your family react to this?
So now I have spent more than you can say 1.5 decade in this profession. So yes, family is also used to this part. Still, whenever the phone rings in the midnight, yes, my kid will get up, my wife will get up. But now they are used to all this thing. This is part and parcel of our life. So yes.
So, what are some things that you would like to do in your free time, Aman, apart from operating on patients?
Yeah. So frankly speaking, I'm a person where till the time I'm in hospital, yeah, I'll not think about anything else. But yes, I believe in enjoying my own life also. So if you see, my schedule starts in the morning at 6 o'clock. After getting up, I'll go to the gym before coming to the hospital, 45 minutes to 1 hour. Definitely, I do that part. And then I drop my kid to the gate of our community, then come to hospital. Once you are in hospital, that work. Evening, again go back, spend your time with the family.
So, it's like switch on and switch off
Switch
mode.
on, switch off, yes, yes.
So, as we've discussed, that aortic aneurysm is like a bomb ticking inside you. So, are there any screening tools to detect this condition early, and who should take up this?
Here, if your family is having history of this kind of disease, then ultrasound abdomen can guide you.
So, talking about vascular health, doctor, what is that one thing that you would like to tell our audience? I mean, how to maintain your vascular health?
I would say one thing, vascular means we are the doctors of blood vessels. We treat artery, vein and everything. And these are also blood pipes, like water pipes and other pipes, it can also get clogged. To prevent that, healthy lifestyle is the first thing. Yes, quit smoking, keep walking and maintain other healthy habits. That's the main part I would like to say to our audience. Second thing, if you are having blood pressure, diabetes and cholesterol is more, try to control it with the regular medicines. These are the few things you should keep it in mind. Then you can prevent all the peripheral arterial or venous disease.
So, thank you, Dr. Bhavin. It was wonderful interacting with you on episode today.
Pleasure was mine. Thank you, Dr. Lakshmi.
So, this brings us to the end of this episode. Well, aortic aneurysm is not the kind of surprise that you want in your life. So, get regular checkups done and follow your family history very closely. And don't forget to join in next week as well. Until then, take care and stay healthy. Thank you.